Hello, student nurses. Welcome to another episode of Mary Evans. Today, we're gonna introduce you to a special friend. She is a contraceptive, specifically a birth control pill that affects the female reproductive system. You can find her in any pharmacy. Before we begin, get a pen and paper and take down notes. Are you ready? Let's start!
Hi everyone, I am Drospirenone, a progestin medication. In this video, you will learn and gain knowledge what kind of drug am I and what are my functions. I will tell you my autobiography. My autobiography contains the following: drug name, which includes the generic name, brand names, and chemical name. Drug classifications, which are subcategorized into therapeutic and pharmacologic. Pregnancy category, mechanism of action, pharmacokinetics, indications, contraindications, side and adverse effects categorized per body system, and nursing responsibilities before, during, and after administration. First, I would like to introduce my drug name. My generic name is ethanyl estradiol or drospirenone. My brand names are the following: Slind, Angelic, Oxella, Yasmin or Yaz, Gianovi, Rajani, Tidemy, Sofirol, and Biaz. My chemical name is 1,2-dihydrospirorenone. Now, let us proceed to the drug classifications. My therapeutic classification is contraceptive. My pharmacologic classification is progestin. Pregnancy category. My pregnancy category is category X. Next, I will explain my mechanism of action. I, as a synthetic progestin, is generally combined with ethanyl estradiol and commonly used as a contraceptive. I intervene with reproduction by significantly modifying the reproductive process. To prevent pregnancy, I inhibit follicle-stimulating hormone or FSH and luteinizing hormone production or LSH, thereby hindering ovulation. I also alter the consistency of a woman's cervical mucus, which hinders the movement of the sperm. This lowers the probability of embryo implantation. Now, I am going to explain to you my pharmacokinetics. First is absorption. My absolute bioavailability from a single entity tablet is about 76%. The absolute bioavailability of ethanyl estradiol is approximately 40% as a result of pre-systemic conjugation and first-pass metabolism. My serum concentrations and ethanyl estradiol reached peak levels within 1 to 2 hours after administration. Second process is distribution. My serum concentrations and ethanyl estradiol serum concentrations decline in two phases. My apparent volume of distribution is approximately 4 liters per kilogram, and that of ethanyl estradiol is reported to be approximately 4 to 5 liters per kilograms. I do not bind to sex hormone binding globulin or SHBG or corticosteroid binding globulin or CBG, but I bind about 97% to other serum proteins. Ethanyl estradiol is reported to be highly but non-specifically bound to serum albumin, and induces an increase in the serum concentrations of both SHBG and CBG. Third process is metabolism. My two main metabolites are found in human plasma and were identified to be the acid form of Me, which is formed by reduction and subsequent sulfation. These metabolites were shown not to be pharmacologically active. I am also subject to oxidative metabolism catalyzed by CYP3A4. EE or ethinyl estradiol has been reported to be subject to significant gut and hepatic first-pass metabolism. Metabolism of EE and its oxidative metabolites occur primarily by conjugation with glucuronide or sulfate. CYP3A4 in the liver is responsible for the 2-hydroxylation, which is the major oxidative reaction. The 2-hydroxy metabolite is further transformed by methylation and glucuronidation prior to the urinary and fecal excretion. The fourth and last process is excretion. My serum concentrations are characterized by a terminal disposition phase half-life of approximately 30 hours after both single and multiple dose regimens. My excretion was nearly complete after 10 days, and amounts excreted were slightly higher in feces compared to urine. I am extensively metabolized, and only trace amounts of Me were excreted in urine and feces. For EE or ethinyl estradiol, the terminal disposition phase half-life has been reported to be approximately 24 hours. It is not excreted unchanged. It is excreted in the urine and feces as glucuronide and sulfate conjugates, and undergoes enterohepatic circulation. Now, I will proceed and I will explain to you my indications if you are going to take Me. I, in combination with ethinyl estradiol, is indicated as an oral contraceptive for the prevention of pregnancy. I am also indicated for the treatment of symptoms of premenstrual dysphoric disorder or PMDD in women who choose to use an oral contraceptive as their method of contraception. I am also indicated for the treatment of moderate acne vulgaris in women at least 14 years of age who have no known contraindications to oral contraceptive therapy and have achieved menarche. I also have approved indications for combination with estrogens for the treatment of menopause-associated symptoms such as vasomotor symptoms and vulvovaginal atrophy. If I am combined with estrogen, I may also aid in the prevention of osteoporosis in women who have been postmenopausal for at least a year and are not candidates for other therapies. After explaining the indications, let us now discover and learn what are the contraindications when taking Me. The following conditions are contraindicated with Me: diabetes, kidney disease with likely reduction in kidney function, a high risk of arterial or venous thrombotic diseases, undiagnosed abnormal uterine bleeding, breast cancer or other estrogen or progestin sensitive cancer, now or in the past, liver tumors, benign or malignant, or liver disease, pregnancy because there is no reason to use me during pregnancy. I am also contraindicated in patients who are at risk for hyperkalemia due to my anti-mineralocorticoid effects and the risk of hyperkalemia. Now, I will explain what are my side effects and adverse effects. The following are my side effects and adverse effects to the different body systems. Immune system. Common side effects: fever and chills. Adverse effects that are rare: hypersensitivity, allergic reaction. Muscular system. Side effects: unusual tiredness or weakness. Adverse effects: back pain, pain in extremity, muscle cramps, systemic lupus erythematosus. Respiratory system. Side effects: pulmonary occlusion, pharyngitis, sinusitis. Adverse effects: epistaxis and asthma. Urinary system. Side effects are not noted. Adverse effects: dark urine. Digestive system. Nausea and abdominal pain are the side effects. Adverse effects: vomiting, clay-colored stools, and gastroenteritis. Nervous system. Side effects: headache, dizziness, and migraine. Adverse effects: somnolence, paresthesia, asthenia, vertigo, tremor, and syncope. Endocrine system. Side effects are not noted. Adverse effects: endocrine disorder. The following are the nursing responsibilities that must be done before administering me to the patient. The nurse must first assess that the client who is going to take me is not pregnant or recently had a baby. The nurse must assess for the mentioned cautions and contraindications such as kidney disease, uncontrolled high blood pressure, heart disease, coronary artery disease, circulation problems, especially with diabetes, and etc., to prevent any untoward complication. Advise the client for the possibilities of gastrointestinal disturbances such as vomiting, diarrhea, and etc. Next, the following are the nursing responsibilities that must be done when I am administered to the client. These are done during administration. Educate the client on the importance of following the physician's order in taking me on the desired time each day. To reduce nausea, I must be taken with food. Advise the client to have a regular breast and pelvic examination and pap smear while taking me. Inform the client that I can make the body retain fluid, making the fingers, hands, or ankles swell. Advise to seek the physician or healthcare professional if the client feels she is retaining fluid. The following are the nursing responsibilities that must be done after administering me to the client. Assess if the client had successfully followed the exact time given by the physician in taking me. Evaluate if the client had met the desired outcome, and assess my effectiveness to the client. That ends my autobiography. I hope you have learned several things from me. Thank you for watching and listening.
We hope you learned a lot. Until next time!